want to ask you about the VA, because one of the things I didn't know about you was that you grew up on a VA post.
I did.
Both your parents worked in VA hospitals. It is not, when you look at the VA as a whole, not just the hospitals, and we've had these horrendous instances that have come up, and the VA chief, Eric Shinseki, has said, we're going to investigate these things. But there's always been this huge backlog for benefits for veterans, all kinds of benefits. 5 years in this job, is it time for Eric Shinseki to find another job?
Yeah, I think, when my parents worked for the VA, I saw a gradual erosion of care. I mean, back when they started after the war, both my parents started after the war. I mean, the VA was a very robust institution, and it keeps getting squeezed and squeezed and squeezed. And I mean, this is, if you want to look at an example of government-run health care, the VA is a good example of. If we treat our veterans this way, imagine how we're going to treat average, ordinary Americans who don't have the political pull and the pull at the heartstrings that our veterans do. This is a good place to look for as we consider Obamacare and consider where they're heading with Obamacare as to whether we really want this as a government system of medical care.
But you sort of suggest that this is a structural problem and not necessarily a leadership problem?
I think it's a structural problem and a leadership problem.
Should he go? Should Shinseki go?
I'm not going to make any comments about appointments. I think he should have to face the music, and if he is proven not to have performed admirably, I think the administration should do what's appropriate.